Hello to everyone. I am Paolo Manzoni. I'm a neonatologist and a pediatrician and a founding member of the expert international network on RSV called ReSViNET. As such, I'm deeply involved in research and assessment of all disorders related to respiratory syncytial virus. And today, I would like to briefly discuss with you the article Evidence on the Link between RSV and chronic obstructive respiratory disorders in infancy and in older age. You all know, I guess, that a link between early inception of RSV and late sequelae in order to, in terms of ventilatory obstructive disorders, have been demonstrated in literature with a solid body of evidence based mainly on retrospective and prospective historical cohorts with several patients followed up and tracked for their respiratory functions over the years up to 20-25 years of age. Most of these studies, if not all of them, show a clear association between early inception and late likelihood to develop obstructive disorders. Disorders that in early stages are mainly wheezing, but at the later stage develop as asthma or even chronic obstructive bronchopulmonary disorders. What's known on these is the actual association. Little is known about why this is happening. Of course, knowing better how this link is taking place would enable us to develop strategies in order to have this link weaker or even to cut this link between these two phenomena. At the moment, the only way to prevent RSV infection is to provide monoclonal antibodies prophylaxis, and this strategy has been actually proven as effective in several pilot studies, not only in preventing RSV hospitalization and short-term disorders, but also in order to prevent medium-term respiratory disorders such as wheezing. In the last years, a solid body of evidence accumulated, and therefore this might be the starting scenario where new drugs and new strategies might add in order to, on one hand, clearly elucidate this link, and on the other hand, at the same time, provide the tools to cut this link and have kids with early inception of RSV being less likely to develop asthmatic disorders in older age.